Here's another reminder that a list of symptoms you see in a video are not diagnostic. Just because you might relate to a symptom and you do not have the condition or diagnosis does not mean that somebody else who may relate to a symptom does not have the condition or diagnosis. When individuals see something and say, everybody does this, these things are normal, you're just looking for attention, it further perpetuates stigma, which at its core is fueled by fear and lack of education and understanding. It may be easier to think about with a physical health condition. So let's say that you saw a video with somebody describing a cough and sore throat. I'm sure at some point everyone has coughed and or had a sore throat. And for most of those people, it was probably no big deal. But that does not mean a cough and or sore throat may not be indicative of something deeper for somebody else. Maybe your cough came from a tickle in your throat, but for somebody else, maybe it came from reflux or strep throat or tonsillitis or anxiety or throat cancer. The symptoms alone are a piece of the puzzle. The actual diagnostic and therapeutic work comes from digging a little bit more deeply. The same goes for mental health symptoms. So if you relate to a list of symptoms and you are living your happiest, healthiest life, that is incredible. That does not mean that everybody who relates to those symptoms is doing the same. When it comes to mental health symptoms, it's less about the symptom itself and more about the driving force or motivation behind the symptom. It's about why the individual feels the need to engage in a behavior. It's about how distressed the individual gets if they can't engage in the behavior. It's about how significantly the quality of life is impaired by or because of the symptom. So does everyone who prefers not to wear socks, likes doodling, or likes things symmetrical have a mental health condition? Of course not. But could those be shared symptoms of somebody with ASD, OCD, or ADHD? Yes. So as a general rule of thumb, if you see something on the internet that doesn't apply to you, you have permission to move on without negating somebody else's experience.